Welcome back to the Big Ideas Theater at AARC, sponsored by Actelion. We're joined now by Paul Miniter. Paul, thanks so much for coming by.
Thank you for inviting me.
You do a lot with AARC, grants and other aspects of AARC, but we're here to talk a little bit about you as not only an expert, but as a patient. Tell us a little bit about your battle, if you will, with PAH.
About 8 years ago, I was diagnosed with pulmonary hypertension, and it was after a series of interviews, diagnosis, misdiagnosis. So it was a long journey to get the diagnosis. And I think if anything, we can take away how important awareness is of the subtle side effects, such as fatigue, headache, of pulmonary hypertension.
Now, you're in a position as a patient to be able to explain better, perhaps, when you're experiencing symptoms than many other normal, regular patients that are not experts. Is this helping in terms of you being able to help clinicians, respiratory therapists, understand what they need to ask of the patient?
Absolutely. I just gave a talk before about patient perspectives in pulmonary hypertension, and it's really a matter of the greatest hurdle in my patient opinion, based upon my journey, was diagnosis. Because once we get the diagnosis, we have about 14 drugs on the market to treat pulmonary hypertension. But to get there is the biggest mountain, is the diagnosis and a clinician understanding of the symptoms, the side effects, because they are so subtle and they can vary from patient to patient.
Can you give us an idea? I mean, what's daily life like?
Now it is very planned. I wake up pretty early in the morning to get my son off to high school, pretty much by 6 o'clock in the morning. But the day is planned around where I know my energy levels are going to be. The morning, maybe 6 a.m. to noon to 1 o'clock, it's going to be a high energy level. But then after that, it's going to drop off considerably, where in the afternoon, under advice of doctor and wife, rest. And that's just a matter of just kind of decompressing, allowing my body to recharge, allowing the oxygen to get back into the muscles, and then finishing the day, if you will.
And you said it's been about 7 years?
It's been about 7 years since diagnosis.
Now, has treatment, has anything changed in that 7 years in terms of the methodology, the treatment, medications, anything that has been of assistance?
My personal treatment plan has not changed one bit. I'm stable on the 4 medications that I'm on. I have been enrolled in 2 clinical trials that during the course of those clinical trials, I've felt substantially better. So, there's new therapies around the corner. There's new research. Thankfully to our pharmaceutical research and NIH and all the groups that are involved in this, it's more therapies are coming about. And like I said earlier, it's really about diagnosis and getting that patient in front of the right doctor and understanding the symptoms.
Is there a lack of awareness? I mean, in the general population, not only and also among clinical therapists?
I think today my perception is that they're still under recognized, especially in the primary care sector. And that was my first visit. My first visit was a primary care doctor, and they didn't know. And even today, when I go to a doctor, and due to healthcare, you might have a new practitioner due to your plan. The doctor or dentist may not know what pulmonary hypertension is, the drugs that you're on. So it's a matter of us providing an entry-level education to that clinician.
Is this also something that, I need to learn for my edification, but is this a genetic, or is this triggered by something else perhaps?
The type I have is coined idiopathic, which is unknown origin. But there are, exposure to toxins. There's a genetic component if you had certain pre-existing conditions. But my specific diagnosis, I had none of those. Not a genetic factor, not a toxin, not an early childhood condition. So mine is truly idiopathic.
Well, where I was going with that is does the different type, depending on if they don't know your source, if you will, but if they have some indication, say it was triggered by toxins, does that change the therapy? Does that change the way that the patient is treated?
It does. Since I was idiopathic, they tried a treatment regimen as soon as I was diagnosed, and only about 10% of the patient population of my condition responds to this, which is a response to calcium channel blockers. And that's one of the regimens I was started on in the hospital, and I'm on today.
Okay, so you, for lack of a better term, almost like a guinea pig. They don't know for sure, so they have to try different methods until
Trial and error.
they can hit that dartboard just
But
right.
I am on the original medicine I was prescribed 7 years ago, and everything clinically I'm stable.
So that's
A good thing.
it's a very good thing.
Yeah.
But a lot of times when your treatment is the same medication, then there's a tolerance build. You know, those types of things happen. But you've been good.
No, and if anything, I've been able to complement that with exercise. So, you know, going back to, all right, what's my new norm, where I was running marathons before now. Like this morning, I walked a mile from the hotel to the convention center. That's my activity for the day, but I know I need to get that in because that helps the medicine and in my journey with this condition.
Does it help? I mean, working with and for AARC, are you able to get in a position of advocating and also in some ways mentoring others who are running across patients like yourself?
It's definitely a discussion point. It's definitely hey, let's talk about pulmonary hypertension, but let's also talk about cystic fibrosis. It's really an awareness of the conditions that may not be on the radar with certain clinician types. I can tell you my respiratory therapy team down where I go is amazing. They ask the right questions, and I learn from them, and they learn from me. So it's a two-way street.
All part of the education.
Yes.
Paul, thank you so much for
Thank
coming
you.
by and sharing your story.
Appreciate it.
And this is the Big Ideas Theater, sponsored by Actelion.